Hello there. I'm going to talk to you about working in the NHS and understanding a little bit about how the NHS structure works. The National Health Service is a free healthcare system to the point of user, which means the patients do not pay. It is paid through the national taxes, and hence ultimately the government runs the National Health Service. In terms of how it is divided, the primary distinction is between primary and secondary care. So primary care is general practice or family doctors that tend to look after everything and anything in the community. And then in the hospitals, we have so-called secondary care, which is more related to emergency care, surgery, women giving birth, and acute medical and surgical emergencies, and includes the emergency department, or as it's commonly known in the UK, accident and emergency. So I'm going to go a little bit more into these two distinctions and what you can and cannot do in each of those areas. So first, let's start with general practice or family doctors. They work in the community, they work with their patients, and they can refer people to secondary care. General practice or family doctors primarily deal with chronic conditions. For example, somebody who has got type 2 diabetes and is on insulin or hypertension. They will deal with medical, surgical, psychiatric, pediatric, obstetrics and gynecology and everything else in between that can be done in the community. They have a limited range of investigations that they can request. So they can do blood tests, they can request x-rays and ultrasounds. However, they cannot request CTs or MRIs. If a patient requires more detailed acute investigations or more specialist care, so for example, if you're concerned that a patient has cancer, then they have to be referred to secondary hospital care. Patients primarily get referred and are seen in the secondary care through a referral from primary care. The other method of accessing a hospital is for a patient to come to the accident and emergency department or emergency care service in an emergency. However, you will find, if you do work in an accident and emergency department, that many patients come in with chronic conditions that are not being well controlled. This is for a number of reasons that you'll get to learn as you work in the NHS. One of the key aspects of primary care that you need to know about is the 2-week wait referral. This is when somebody is seen who is considered to potentially have a cancer. If a GP sees a patient who they think might have a cancer, they will refer them under the so-called 2-week wait pathway. This means that the hospital specialty, for example, if somebody has a change in bowel habit and weight loss and we're concerned about bowel cancer, the patient will be referred under the 2-week wait pathway to the gastrointestinal or colorectal teams. It is the responsibility of the hospital service to see that patient in that service within 2 weeks and then arrange appropriate investigations. If you are in hospital, medicine or surgery and you are seeing a patient that is suspected to have a malignancy and requires referral to another service, for example, if you're in the acute service and you're seeing a patient in the accident and emergency department, you will do the same 2-week wait referral pathway to that specialty. So whenever your senior consultant or senior GP requests that you think you should do a 2-week wait referral, you now understand what that means. In hospital, we have secondary and tertiary care services. I'm going to talk a little bit more about the secondary services. So a secondary service is a hospital with an acute emergency service, which will include accident and emergency or emergency medicine. It will include acute surgery, obstetrics and gynecology, acute medicine, and an intensive care unit. You will not have what we call tertiary services, such as neurosurgery, cardiothoracics, or vascular surgery, or plastic surgery. And some sub-medical specialties, such as acute stroke, will also not be available in certain hospitals. However, the breadth of medical and surgical emergency presentations will come in, and you will be under the supervision of the consultant of that team. When you join the NHS as a junior doctor, you will be in rotation in several different departments, but the general umbrella will be whole of medicine, surgery, obstetrics, gynecology, or paediatrics. For example, in medicine, you may do rotations in respiratory, cardiology, gastroenterology, endocrinology, and so on. Tertiary hospitals, which are teaching hospitals normally associated with a university, will have extra services such as neurosurgery and cardiothoracics and plastic surgery. And they take referrals both from GPs, the community medicine doctors, as well as the secondary services. And many senior doctors cross-cover both types of hospitals and work in both settings. One of the other areas you will hear a lot about are the NICE guidelines, the National Institute of Clinical Excellence. These are peer-reviewed, evidence-based guidelines which are used nationally to guide treatment options for hundreds and thousands of different conditions. These are then interpreted locally by each hospital or GP practice that will then employ them for their local population. Depending on where you work in the United Kingdom, there will be different population bases. So, for example, in London, we have a high diverse population with people from all over the world. Whereas if you work in somewhere rural, such as in Wales, you will find it's primarily a Caucasian population. And hence the disease presentations that are most likely are going to be different depending upon where you work. Another aspect you need to understand is about social services. In the United Kingdom, we have a state-provided social services that helps provide support for those who cannot support themselves. So, for example, elderly people who need care, who are unable to be looked after in their own home, maybe go to a state-provided care home where carers are then provided. Also, carers can come from the state into an individual's home to look after them in their own home. We also have something called safeguarding. So an example would be if you see somebody in your practice, either in the community or in hospital, for example, a child that you are concerned has been abused in some way, be that physical, emotional, neglect, psychological or sexually, you have to put in what is called a safeguarding referral. This is where you flag up to these social services that there is potentially a child at risk, and they will investigate further to ensure that child is safe. Wherever you end up working, you will need to learn the local guidelines and the local policies about social services and referrals, because each individual organisation will have slightly different referral pathways and different policies. This will be covered in your induction when you join that service, and every time you go to a new hospital, GP clinic or organisation within the NHS, you will undergo an induction where you will learn all about the different local policies. We have put in the description with this video some links for you to look at that you can learn more about this subject. Thank you.